All right, guys, today we're going to talk a little bit about radio reports, written, verbal and bedside, and then written reports. So all reports are the same, starting with the verbal report you give in the beginning, then the bedside is an elaboration on that, and then your written report is a elaboration on both of those to what happened. I like to use charts for both, for all of those. I'll kind of walk you through why and how I do that. But what's required, what's out there, what's kind of the bare minimum that's out there. Okay, so you're required to give a verbal report. The encode is how we let the hospital know that we're getting there, and then it lets the doctor accept the patient, and now it tells you what destination you're going to. The next thing is that you're going to give a bedside report to the nurse that you're transferring to. That is required by state law. In that report, there has to be history of present illness, pertinent past medical history, vital signs, and why they're there, okay? Or medications, allergies, and why they're there. Okay, so in there, so charts covers all that, right? And then you have to give a verbal report and you have to give a written report. So we give the radio to give them a heads up, we give them the bedside, required by law, and then we give the written report, which is sent via computer on ESO, and that's required that happens. Okay, so all those things have to happen. So how do I give a quick, efficient report? Why does it matter? We talk about the best way to see this at St. John's Tulsa, because the phone is right there by the charge desk, and if you're ever hanging on a bed delay, you can see them do this. You'll see them go answer the report, and you'll see the medic, or you'll hear the medic rambling on and giving a really detailed report on something that's not emergent, and you'll see the nurse put the phone down and walk away because she has other stuff to do, and none of that information is pertinent. So they're not gonna waste their time on it, especially nowadays when they don't really hire people to answer the phone anymore. You used to have techs, etc., that would work computers and different things, and you didn't have a nurse that was sitting on that phone all the time. Most places now, that's an extra job that the nurse does because of staffing issues. You may not even have, like you see this a lot here in Owasso, you may not have a dedicated charge nurse. The charge nurse is just whoever the senior nurse is that day, but they're still taking care of patients. So they don't have a lot of time to listen to you ramble on. So quick, to the point, but you have to get all the information apart. So the first report, written report, how do I use charts? Chief complaint, history of present illness, pertinent past medical history, my assessment, my treatments, my transfer information, and then anything special at the end. So how does that transfer to the radio? Okay, so right off the bat, this is Medic 2 to St. John's Owasso. They answer back. Hey, this is Medic 2, I'm gonna be inbound, and I'm gonna be inbound, emergent or non-emergent. Today we're gonna be non-emergent. I'm gonna be non-emergent. I have a 52-year-old male, chief complaint of pain. Okay, this person's, this guy says that his legs have been hurting for 2 months. No recent falls, no trauma to aggravate it, just more pain than normal. Quick assessment. He was able to walk to the cot, and it tells him how serious it is, right? Vitals are as follows. Patient's A-node 4, GCS 15, he's got a heart rate of 100, sinus rhythm, his oxygen is 100% on room air, blood pressure 120/80. We have established a IV, blood sugar is 83, nothing else from us. We're about 10 to 15 minutes out. Do you need anything further? Anything special? We can have a conversation. So charts. So the same way to think about it. Nice little order, very quick, to the point. Gets it across, takes 60 seconds to do. Lets the hospital know what's going on. They have the report. They'll tell you nothing further. Silent on arrival, right? So boom, got a quick written report. Now we go to bedside once we get there, and we're gonna give them a little more information than we gave over the radio. This is because you're talking face to face. This is the time to elaborate. You can tell them, hey, this is Rick, he's 52 years old. He says that his legs hurt. They've hurt for a couple of months. He hasn't been to the doctor to get him checked out. He says he hasn't had any falls. He doesn't know why. And we don't know why it got worse today, but he says that it did, and he called and he wants to get checked out. I didn't see any trauma on it, nothing to be concerned with. His vital signs were good. If they want them, repeat them to them. We do have an 18 gauge IV in the left AC. Blood sugar's 83. We didn't give anything else. And you can tell them anything special at the end. So the same way. All I did was do the exact same thing, but I elaborated a little more on what had happened, and I just gave them more information, such as the size of the IV, and I gave them the longer story. If they had any pertinent past medical history or meds or allergies that are in there, I would pass them on to them. If they don't, then I'll leave it out. Or I could throw them in there and say, this guy doesn't have any past medical history at all, says he hasn't been to the doctor in 20 years. He's not taking any medication currently. He doesn't think he has any allergies. Done there, just more elaborate. Okay? So then we go and we write the report. When we write the report, we're gonna use the chart format, okay? We have templates online if you need help with this, or hit me up and I'll walk you through how to use charts. But all we're doing in our written report is we're just gonna add even more. We're gonna put everything in. This time, we're gonna have a chief complaint, okay? We're gonna have the history of the president knows what happened. We're gonna talk about any pertinent past medical history that he has, any medications or allergies that could affect what's going on today. We're gonna give a detailed assessment, and there has to be a head to toe assessment in there that's written down. And we'll go through our treatments, same thing in order. Every treatment section, every time has to say that there was an assessment, there's a set of vital signs taken, and then if it's anything that has to do with cardiac or breathing in any way, they need a 4 lead. If they have chest pain or shortness of breath, they need a 12 lead. Whatever IV size we started, any medications that we did. Throw the sugar on the end, throw the body temperature on the end. Just write it out, write what happened. Doesn't have to be super long thing, just write. Boom, this is what happened. Assessment, comma, vitals, comma, 4 lead, comma, 12 lead, comma. If you want to get a little more detail than that, you can. Transport information, okay? So when your written report, this is not a time anymore. This is where we went. The patient was transported to St. John's Owasso per request. The verbal report was given via the radio, bedside report given to RN. No belongings were transported, and the patient was left with staff at bedside 804 GCS of 15, okay? All pertinent transformation that's in there. Where did we go? Why did we go there? Did we give our reports? Did we drop the person off to somebody? Did we have any belongings in case something got lost? And were they still in good shape when we left them? Special information. Okay, you see a lot of people put MRN down here. It's a good place for it. Okay, we know where it goes now with the chart number. We know where that goes. But if you forget, or you want to put it in there as extra, or anything else that's pertinent down there, I mean, what this is really meant for is special stuff that could pertain to the call, such as this is the next of kin information. This is the last known normal time for a stroke. This patient said this or did this, or PD was on scene, there was this or that happened. Throw it all in the special report that's down there. But down and dirty day, pretty easy. Radio report required, verbal report required, a radio report, then a bedside report, and then a written report. All 3 things are required by law. We have to do those things. We use charts here at Owasso because it keeps things nice and easy. It gives a standard for us to do QA by, okay? If you're using SOAP or you're using some other method and you're still trying to use that, you're probably gonna get those sent back to you. But if you struggle with charts, no problem, man. Give me a call and I'll walk you through how to do it. We also have templates on the O drive for almost every call. And if you want to see another template that's out there, let me know. I'll go write them. If you're good, I'm not gonna waste my time and write extra templates for no reason. But if you want some more, let me know and I'll put them on there. Thanks for watching. And if you have any questions, just hit me up and I'll answer them for you. I'll see you guys next time.